Welcome to the Nightly Rant
with
your hosts, Mike
and Torya.
This is the show where we examine society from a sarcastic point of view.
If you like insane conversations, this is definitely the show for you.
Let's get into today's topic. YPN people, I don't know about you, but I love helping out a friend. That's why I want to shout out my friend Brian Little and his podcast, Your Favorite Blockhead. This is the only show that manages to weave together peanuts and MMA into one heck of an amazing podcast. You can find Your Favorite Blockhead wherever your favorite podcasts reside and at yourfavoriteblockhead.com. Do me a huge favor and listen to Brian's show. You'll be entertained and you'll help out a friend. Now, as I said, let's get into today's topic.
So you know how the new rage everyone's talking about, Chat GPT?
Wouldn't necessarily call it a new rage, but yeah.
So I keep hearing, everyone, I didn't say it was new, but it's gotten huge now. Like grandmas know who Chat GPT is.
The Russell knows who Chat GPT is.
There you go. So
he doesn't like it, but he knows.
I got an article for you that I find really interesting. The title of the article: a boy saw 17 doctors over 3 years for chronic pain. Chat GPT found the diagnosis.
Alrighty. So
I'm going to kind of paraphrase some of it, and I'll read some of it verbatim because there's quotes. But during COVID-19, this woman named Courtney, she got a bounce house for her 2 young children.
Mm-hmm.
Okay. Her son, Alex, though, who was 4 at the time, began experiencing pain pretty soon after. The nanny would start telling me, I have to give him Motrin every day or he has these gigantic meltdowns. Courtney, who asked not to use her last name to protect her family's privacy, tells today.com, if he had Motrin, he was totally fine. Well, then Alex began chewing things, so Courtney took him to the dentist. What followed was a 3-year search for the cause of Alex's increasing pain and eventually other symptoms. So pretty weird, right? Like, we've all heard about these situations.
Yeah.
And they don't know what's wrong with it. So the beginning of the end of the journey came earlier this year when Courtney finally got some answers from an unlikely source, Chat GPT. The frustrated mom made an account and shared with the artificial intelligence platform everything she knew about her son's symptoms and all the information she could gather from his MRIs. We saw so many doctors. We ended up in the ER at one point. I kept pushing, she says. I really spent the night on the computer going through all these things. So when ChatGPT suggested a diagnosis of tethered cord syndrome, it made a lot of sense, she recalls.
And there was an episode of Grey's Anatomy where that was a thing. And it was brought out by something like a trampoline.
So right. And this was a bounce house.
Yeah.
And so the whole chewing thing, they thought that maybe his molars were coming in and it was causing pain. Then when it continued, they thought he had a cavity. They said that our sweet personality, for the most part, child, was dissolving into this tantruming, crazy person that didn't exist the rest of the time, Courtney recalls. So the kid was going nuts from the pain. Quite literally going nuts from the pain. And then the dentist, quote, ruled everything out, end quote.
Well, a dentist isn't going to know about tethered cord syndrome.
But he thought maybe Alex was grinding his teeth and believed that an orthodontist specializing in airway obstruction could help. Now, airway obstruction impacts a child's sleep, and it could explain why he seemed so exhausted and moody. The orthodontist found that Alex's palate was too small for his mouth and teeth, which made it tougher for him to breathe at night. She placed an expander in Alex's palate, and it seemed
that poor kid.
And it seemed like things were improving.
It hurts.
Everything was better for a little bit, Courtney says. We thought we were in the home stretch, but then she noticed Alex had stopped growing taller. So they visited the pediatrician, who thought the pandemic was negatively affecting his development. Courtney didn't agree. I know, right? But everything's
What
the
the
damn
fuck is
pandemic's
that?
fault. Everything is the pandemic's fault. Don't you know that?
God.
Courtney didn't agree, but she still brought her son back in the early 2021 for a checkup. He'd grown a little bit, she says. The pediatrician then referred Alex to physical therapy because he seemed to have some imbalances between his left and right sides. He would lead with his right foot and just bring his left foot along for the ride, Courtney says. So he was basically like,
Yeah.
walking like Quasimodo, 1 foot drag, 1 foot drag. But before seeing the physical therapist, Alex had already been experiencing severe headaches that were only getting worse. He visited a neurologist who said that Alex had migraines. Wow, what a crazy diagnosis. The boy also struggled with exhaustion, so he was taken to an ear, nose, and throat doctor to see if he was having sleep problems due to his sinus cavities or airwaves. No matter how many doctors the family saw, specialists would only address their individual areas of expertise. I mean, obviously.
Right.
Nobody was willing to solve the far greater problem.
I would have thought the neurologist would have been able to figure it out, though.
Nobody will even give you a clue about what the diagnosis could be. Next, a physical therapist thought that Alex might have something called Chiari malformation, a congenital condition that causes abnormalities in the brain where the skull meets the spine. Courtney began researching it, and they visited more doctors, a new pediatrician, a pediatric internist, an adult internist, and a musculoskeletal doctor. But again, dead end.
Also, a musculoskeletal doctor should have been able to figure it out.
So, pissed off and tired, Courtney signed up for Chat GPT, and she began entering his medical information. I went line by line of everything that was in his MRI notes, and I plugged it into Chat GPT, she says. I put the note in there about how he wouldn't sit crisscross applesauce. To me, that was a big trigger that a structural thing could be wrong. She eventually found tethered cord syndrome and joined a Facebook group, families of children with it. Their stories sounded like Alex's. She scheduled an appointment with a new neurosurgeon and told her she suspected Alex had tethered cord syndrome. The doctor looked at his MRI images and knew exactly what was wrong with Alex. She said point blank, "Here's ocula spinal bifida, and here's where the spine is tethered," Courtney says. Well, it just says that, tethered cord syndrome occurs when the tissue in the spinal cord forms attachments that limit movement of the spinal cord, causing it to stretch abnormally. Okay. So what happens is it's like the spinal cord gets stuck on something.
Yeah. Literally tethered.
And it gets like, it could be a tumor that could do it. It could be a bump of the spine or bones. It could just be too much fat. Right. But it elongates and pulls on the spine, which obviously isn't a good thing.
Sounds like it would hurt all the places in your body.
And it says if you have spina bifida, a birth defect where part of the spinal cord doesn't develop fully and some of the spinal cord and nerves are exposed. In many kids with spina bifida, there's visible opening in the child's back, but the type that Alex had, his cord is closed and considered hidden, which means it can be difficult to diagnose. So he had spina bifida, which caused this syndrome, right?
Yeah.
But ChatGPT literally read the notes that the mom typed in from the MRI report.
Man, if I were
and
people,
gave the correct diagnosis.
If I were people, after reading this, who have gone years and years without a correct diagnosis, I would do exactly what this woman did. You know why? Because ChatGPT has the ability to reach to the deepest, darkest corners of the internet to find the most obscure studies. And it also can reach to all the places on the internet and match every single symptom, something that no doctor is really going to be able to do. I mean, they're only human.
No, you're right. I mean, it has its limitations. It doesn't have data before 2021, for instance.
Right.
It has its limitations. But for things that you're, like a medical kind of issue, in a sense, what you just said is totally true. What you basically just described is a medical doctor sitting in front of a computer and just answering a questionnaire about every possible symptom. And in the end, going click, and then the computer going, oh, here are the top 3 possibilities.
It's like a hyper advanced version of the WebMD diagnostic thing.
Yeah. I mean, it's just intense.
That thing always told you had cancer, though. So.
Yes, but that's what ChatGPT did there. It just took everything and then it did its computer thing. It went out, like you said, and it checked off all the boxes. And it was like, all right, well, there's only one thing that I can diagnose out of all this. Boom. And it was right.
The other advantage ChatGPT would have over even a large group of physicians is there's no ego and no preconceived notion.
Well, yeah, exactly. And I think there's going to be some people, though, that are going to use that, artificial intelligence is such a threat. It's such a threat. People will be practicing medicine without a license. Well, that still comes down to, I have an opinion about stuff like that. And it's really, really simple. If someone is willing to take that risk and practice medicine without a license with artificial intelligence, they would be willing to take that risk without it.
ChatGPT does not exist to replace any human profession.
Well, but I understand that.
Exists to supplement things.
I understand that. And people make the argument that, people are going to practice medicine without a license. And I say that anyone who's so inclined to use AI to practice medicine without a license would also practice medicine without a license without having AI around. That's just something they're so inclined to do towards doing.
Right.
I don't think the AI made them go, let's do it. No, the AI just made them lazy and said, okay, let's still pull the same scam, but let's get the AI to get the answers for us, because then we're less likely to get in trouble. And It's true. I mean, it got that diagnosis exactly correct.
I would be interested to just put symptoms in for something you've already been diagnosed with and see what it comes up with. I might play with it later.
That's an interesting thing. But to your point, I 100% agree with you. You said it, probably very much towards the beginning of the story. You said anyone who's had a few couple of years and they're trying to diagnose a problem and they're frustrated and it's not being diagnosed, that it's worth doing what the lady did.
It probably took an hour of her time, and it gave her a new suggestion to ask her doctors about.
And voila, it was the answer. That's crazy. I mean, it could have totally been wrong, but it wasn't.
Right.
That's just insane.
It put the idea in the doctor's head, and the doctor saw the markers.
I think Harvard Medical School, if you're listening, you need to send ChatGPT an honorary Harvard medical degree.
Don't do it.
ChatGPT, he, she, it is owed a degree. I can't believe that. It just blew my mind when I read that. And that's why I thought, well, we have to share it. I have to share it with Torya. Then I was like, well, you know what? Rather than share it with Torya, I'll share it with Torya in front of the rest of the world.
I had to have one of those things that expanded my palate before I had braces. It was the most painful year of my life. My head always hurt.
I can imagine.
It was awful. I feel really bad for that kid that's something that they subjected him to when he was already feeling all the pain.
See, like me, I have that degeneration in my neck.
Yeah.
And so sometimes I get if I'm in front of the computer a lot, like I was today, I get really tight in the neck.
Uh-huh.
And then I want to release the tension, but it's not the kind of tension that you can just release by moving your neck around.
Right.
And we've proven by your help and also a professional masseuse that pain actually starts lower in the back, like towards the middle of the back.
Yeah, because you have a little curve in your spine.
Yeah, but when you release the muscles, all of it goes away. And then my neck will crack and then I feel fine.
Yeah.
So anyway, I think that the whole story about Courtney and Alex and finding out what was wrong with Alex by using ChatGPT is just the beginning of many more stories like that.
And we should have asked ChatGPT what was wrong with Jasper.
Still could.
Well, I mean, he's all better now, so.
I was thinking about that. So we'll give you the Jasper update. I was thinking about that. I was like, how come the first doctor literally made the comment that sometimes the object will get caught around the tongue and they just cut it and then it'll pass? But he said there was nothing in there. How carefully did he look? Because I get it. It's white. I get it. But he didn't put his finger back there to feel because he would have felt.
She said she did. But I think because it was white thread and because he was so dehydrated that the thread was probably gooey and like blended in. She said his gums were sticky. It probably blended in because the other doctor said she didn't find it until they knocked him out and he relaxed.
Well, I'm gonna go with your excuse because that's what I'm gonna call it. Because we neither one of us could ever get the actual answer, so it's just an excuse that we're making for them. But that's fine because that's how we get to a conclusion. And I'm gonna go with it because I'm gonna assume good intentions. Because the only other thing I can do is assume that like, oh, they saw it and they knew that then they could, convince you to have an expensive surgery, and that would make me mad.
Didn't strike me as the type.
Well, me either. And that's why I'm so easily giving in and going in your direction.
Now, if it was that doctor that we saw that one time that you almost walked out of, maybe I could get in your bandwagon. But there are very few veterinarians that I would put in that category.
Where was that?
Same clinic. I'm just not going to name which vet it was.
Oh, I remember.
Yeah.
I remember. Oh, never again.
When I had made the appointment with our regular vet and they arbitrarily switched it to a random vet.
Oh yeah, well, I remember
Mhm.
now. You don't have to remind me, make me mad. But guys, I guess bottom line is get the mind opened. Anyway, the Jasper update. Where did we leave off the last time with these people with Jasper? I know we told them about
Well,
this
it was
strain.
last Tuesday, so it was like 5 days post-surgery.
Okay, so we already knew about the 155 and a half inches of
string.
white thread.
And they already know that the vet stole all his fur and that you've been
And
teasing him all
I've been
these
teasing
days.
about that. Okay, so we had this. We've been told by the vet, which I thought was really helpful. We were told, look, we don't know how bad it was in the intestine. We just don't know. There's too much fat in there. And it's not safe to go poking around in there. And there was no point in going poking around in there. But it's possible for pieces of the intestine to die.
Which is terrifying, by the way.
Yes, it is terrifying. And then then you have an emergency situation. You have to bring him in right away.
Right.
At
which point they would have, I'm assuming, sliced out pieces of his intestine
and pieced them together. Yep.
Oh, I'm so glad that didn't happen.
Well, imagine the recovery for that. But anyway, they told us between 5 and 7 days was like the scary zone. Like, beware, man.
So Thursday at like 6 p.m., I was like having a mini dance party because it was officially exactly 7 days post-surgery.
Yeah. Yep. And we were really excited the next day because it was for sure past the deadline.
Right. But then Sunday.
Yes, little update on this now.
So 10 days post-surgery, some little jackhole starts barfing up all his food.
Yeah.
But he's still hungry.
But then interestingly, we kind of had a communication mishap because I asked you, had he used up all his medication? Because I couldn't remember, to be honest, that it was an antacid. I didn't want to say something stupid and you'd be like, what are you talking about? He didn't take that. And then I'd be like, God, I'm so dumb. Instead, I just left it at medication. But by leaving it at medication, I forgot that he also had pain medication and antibiotic medication.
He had two painkillers, he had an acid reducer, and he had an antibiotic.
So he was only taking the antibiotic was the only thing that was left at the time that I asked the question.
Right.
And so you said, oh, no, he's still taking the medication. Well, of course, because I said medication, an antibiotic is medication, but I meant the other medication that stops the acid. I just couldn't remember what it was called. Well, ultimately, that's what they give him. Right? More of that because I think I was probably right. I think you're right that cleaning himself, because we let him clean himself up.
Well, Butthead gave himself quite a hairball.
But he gave himself a huge hairball. And I think that's what was coming up when he was throwing up was hair. And I think that by doing that, it made him just have a sensitive stomach because then he'd go right away and go eat.
Had too much fur in his stomach.
But then he'd go eat.
Yeah.
So I think, the key was you ferminated him, right? Before you took him out.
did. And then he gave himself 17 baths.
But at least you took the hair away. And we have to make sure to give him the hairball stuff.
Yeah.
I gave it to Parker again today.
He does not take it nicely, by the way. You have to open his mouth and put it in his mouth.
Yeah, you told me that.
But So the little jerk got lucky, really, because it means by taking him to the vet today, because I was having a mini helicopter mom panic attack, that he got his stitches out 3 days earlier than he was supposed to, and got to take the cone off 3 days earlier than he was supposed
Yeah,
to.
it all actually worked out in his favor, and I think he tricked us.
I think so too.
I think
he was heaving the food up on purpose, the little bastard.
I think he did it because he knew that he'd have to go back to the vet, and then the vet would be like, "Okay, we'll take them stitches out. No more cone." Whoop,
Yeah,
whoop.
because he hasn't thrown up at all today. Well, at all since he had breakfast. How about that?
Yeah, let's not jinx it.
And he has spicy tummy stuff, and we'll
but I would say
give that to him for a few days.
Yeah, I would say he's recovered.
He's fat and sassy, so yeah.
I think he's 90% there. Yeah.
Yeah.
Once we get past this stomach thing, he'll be all the way there.
He was so funny when I took the cone off and I put just his collar on. I think he knew that was the end.
Like he figured it out.
Right. And so he got into this like weird position where he was sitting like a Who-Man, and his little front paws were dangling down at his sides. So he and he was leaning over and licking the where the incision was. And then he kept like sideways glancing at me, looking at me to see if I was gonna stop him.
That's cute.
Yeah. And all I did was roll him over when he was done to make sure he didn't cause any like redness or any bleeding or anything like that. Because when he licked himself before, he was trying to chew that scab off.
Yeah.
And he like
went too hard.
Chewed his skin off.
Yeah, he went too hard.
Yeah.
Well, I mean, the best thing to do is just keep an eye on it, and as long as it's not getting red and bothered, then he can keep the cone off and you're good. The only reason to put the cone on is if he's irritating something and we don't want it to get infected, because then it's more time back at the vet.
Right.
My God. But the
if
good
he
news
starts to irritate it, I'll put a little Neosporin on him and the cone on for a while.
But the good news is that the bill was the cheapest bill we've ever had for an animal. For
56 entire dollars.
56 whole dollars out the door, and that included the medication.
Yeah.
I think you're right. They didn't charge us for the visit because we had just had surgery. And so it was kind of lumped into the post-surgery care. But it was cool. Like he was very happy. If you noticed, he wasn't as Maui on the way home as he was there. And that's because he knew, the boy knew it was coming. He was ready to get out the cone.
So when we got home after bringing Jazzy back from the vet, I gave all of the other animals a lecture that they're not allowed to do anything requiring themselves to be put in a cone ever again.
Yes, I was there. It was funny. And they all look at you like, okay, whatever. And then they go and they violate your rules and hurt themselves. I want to punch them sometimes when they do that.
Yeah, pretty much.
But, I think that Jasper really shook us up. Like it reminds you of, how much you care for these little beasts.
It's a very emotional experience.
Yeah, it reminds you how much you care for these little beasts. I mean, even me, like I got emotional just thinking about it. And I try not to get attached to animals other than like the ones that, like Bree and Yogi that I'm like really.
And Jasper, he's your
Jasper's like
best friend.
Jasper's like my best buddy cat. Yep. He's like, he hangs out with me and I think he thinks I'm his best buddy human.
Yeah.
So, he sits with me and we hang out and I talk to him and I pet him, and then I didn't have him for 2 days.
I'll admit
3 days actually.
When we went to the vet to try to give him food last Friday, and they brought this sickly little bump out, and his eyes were all sunken, and he had like medication all over his face, and he was all dirty, and he just looked so sad and sickly. Like I ugly cried in front of you, and that hasn't usually happened.
Yeah. Well,
poor little baby.
He's come such a long way, people. Like the kitty cat has progressed beyond belief.
He's destroyed my office from being stuck in there overnight. Like he knocked everything off my shelf pretty much last night.
He had enough.
Yeah.
He had enough, that boy. So
next time he convalesces in your office.
Will we'll keep giving you updates on Jasper on a regular basis, but probably not every episode. But we'll keep giving you updates because he's going to continue to recover from his
now
surgery.
He has to grow half his fur back.
Yes. His bottom half is rather naked.
And his front leg.
And we're about 30 days out from Bree's surgery.
Yep.
Man, I just can't even.
Yeah, we got to start looking for the stuff for that. But we'll give everybody an update on that next time.
Yep. All right. Well, that's all I got for you.
Well, good night, everyone.
Hasta la bye-bye.
Thank you for listening to the Nightly Rant.
If you enjoyed the show, please give us a 5-star rating on Apple Podcasts or Google Play.
If you didn't enjoy the show, please just ignore that previous request for a rating.
This has been a Yogi's Podcast Network production.